Alrighty, I'm just making sure we are live here before we get going, and I think we are. I see the little red live button. Wonderful. Hello, everyone, and welcome to day 3 of the Boys Town Pediatrics Spring Newborn Expo. My name is Gabby. I am your host for the week. We are going live every single day with a Boys Town pediatrician to discuss a different topic as it pertains to you and your newborn. On Monday, we went live on feeding, and yesterday we talked a little bit about newborn and routines. So make sure to go back and watch those videos if you missed them. Today we are live with Dr. McCarthy, and we are going to be talking about what to do when your baby gets sick. Dr. McCarthy, how are you doing today?
Great. How are you today?
Great. Good to have you on.
Yeah, thanks for having me.
Yeah, so we are going to go through several discussion questions during this live session. If you're on and watching live, we are doing a giveaway. If you're interested in winning a loved photo frame with an infant onesie set from Boys Town Pediatrics, make sure you like this video and leave a comment below to be entered. This giveaway is local to residents of Omaha, so please enter. And if you want to enter but maybe haven't disclosed your pregnancy to friends or family, you can always message our page directly privately, and we'll be counting those entries as well. Okay, Dr. McCarthy, so it's inevitable. Baby is going to get sick, and we are going to work through that together with these discussion questions. So what are the signs of illness in newborns?
So there's lots of them, right? So it's hard to really pin down specific things. What I like to tell parents in general is that you get concerned whenever you feel like something's not right. So mom, dad, intuition is really important because you can't really study everything that could possibly go wrong. Some of it comes on experience, and then just that feeling that you get when things aren't how they're supposed to be. That's when you let us know. Certainly, when we think of illnesses, we all think of respiratory illnesses, which are the runny noses and coughs and nasal congestions and breathing problems that are probably the most common thing that we see. And then there's gastrointestinal, which is things like vomiting or diarrhea or problems digesting food. And then skin problems would probably be the third most common thing that we see. And just overall, it can be as simple as fussiness, or we're concerned that feeding isn't going well, or that maybe the baby feels hot and there's a fever. That's actually probably the most concerning finding, is if would be a fever in the newborn period. But those are a few different examples of what quote unquote illnesses may appear as.
What should we do if our baby has a fever?
So first of all, when should you check a temperature? If the baby's feeling too cold, feeling hot, we're concerned about the baby's behavior. That'd be an indication that you should probably check a temperature. And a fever we define as 100.4 degrees Fahrenheit or higher. And that's really, when you should check a temperature, is if you're concerned about, an illness, and that's the definition. And then if there is a fever, then especially in that newborn period, the first 30 days, a baby really should be seen right away. That's not something you want to wait around or give Tylenol or think, well, maybe let's just kind of see how it goes. In the newborn period, that's kind of what we define as an emergency. So the baby should be seen right away.
What is the best way to take a newborn's temperature?
So the most precise measurement of temperature would be rectally. So there are lots of thermometers out there. There's the temporal thermometers. There's the oral thermometers. And generally speaking, you can start. I usually recommend in a newborn period, you can start with a little axillary temperature just under the clothes in the armpit, hold it there. And that can kind of give you a screen, just a general screen of a temperature. But if you really are concerned about a possible fever, rectally is the most precise. Now, a lot of people are hesitant with that. They're like, well, we don't want to hurt the baby or make the baby uncomfortable. So it's not too complicated, and it shouldn't be painful. The thermometer doesn't need to go in far. It's really just far enough to cover the silver part at the end of the thermometer rectally. And you can use a little Vaseline, is fine, just to help it be more comfortable. But if we want a good temperature, that's really the best way to go.
Great. What common infant illnesses should we be aware of going into parenthood? Some of the most common ones we think of, I know, are COVID, RSV.
Right. So if we think about infections in general, you can kind of break them down in 3 different categories. You have your viruses, which are the most common infections that we're going to see in clinic and that parents are going to deal with. You have bacteria, which usually come in after a virus, or like kind of secondary infections. That's when you think about like ear infections, pneumonia, skin infections. Those are the most common. The second most common, probably the bacteria. And then the third, less common, we still see them some, are the kind of fungal infections. Those are things that we tend to, if people have heard of thrush or skin infections, like diaper rashes can have a yeast, which is a fungus in it. That'd be kind of like the third most common type of infection that we see. Yeah. Certainly everyone's heard of COVID, right? We know about COVID. That's we lived through it, right? So that's been everywhere. We're familiar with that. Probably less worrisome, much less worrisome now than maybe even some other viruses that we see more regularly. When people think about just the flu, I don't think the flu gets quite enough credit for its how dangerous it really can be at times. So the flu would be one. RSV, sometimes people have heard of that. That can be more, worrisome, especially in that newborn infant time period. So RSV is another one. I mean, the list goes on and on. As far as like, diarrheal illnesses, the rotaviruses and noroviruses, are things that are out there. There's a lot, and it can be kind of overwhelming. Common things are common. Certainly we see certain infections much more commonly. We would see other things, but it tends to be, that's how you can kind of break it down, I guess, a little bit.
Mm-hmm. And, with all of those ones that you mentioned, I know there's probably no such thing as typical because it changes from baby to baby. Expect babies to be sick for, and does it change depending on the virus?
So it kind of depends on how old they are, and then also what particular viral illness we're talking about. So for a cold, which is your upper respiratory infection, your rhinoviruses and other such viruses that can cause cold symptoms, the congestion and cough, I normally tell folks 7 to 10 days. And that's pretty accurate for an older kid. 7 to 10 days is a typical course. And then even adults too, you get a cold 7 to 10 days. It kind of runs its course. In babies, especially 2 months and under, if they were to get a cold, you might anticipate it to go a little longer. So sometimes that congestion and cough may last 2 weeks or so. Mm-hmm. And then the cough is normally the last thing that goes, right? So everything else will clear up. The congestion will be better. Maybe feeding will be coming back. If there was, any other symptoms, those are kind of better. And then sometimes you can get this lingering cough that happens, and sometimes we see it for 2 to 3 weeks.
Mm-hmm. Yes.
Now, then there's the diarrheal illnesses, which generally speaking are in older kids, school-age kids. You see it more, but certainly in the infancy, you can see those. And sometimes the vomiting and diarrhea, vomiting will last a couple days, 2 to 3 days typically, and then 7 to 10 days sometimes for diarrhea. And once again, we're talking about averages. We're talking about how things normally go. There's outliers. Some things are quick and they get better faster. Sometimes things last a little bit longer. And so we talk in terms of averages, really.
Sure. And with vomiting and diarrhea, especially, I know dehydration is a big problem. Mm-hmm. Sometimes we get the question too with newborns of what can we do if we're feeling that they might be dehydrated and past the newborn phase as well.
Mm-hmm. Yeah, some of the best things just is the baby making wet diapers. That's how we think about dehydration. If the baby's peeing good, we'd say minimum once every 8 hours, but typically the baby's you're talking more like 6, 8, 10 times a day that a baby should be making wet diapers is a good sign that hydration is adequate. Mm-hmm. Now, parents will frequently notice, the diapers aren't as much as what they previously were making, right? So parents will come in and eating less and not as many wet diapers that they previously made. But as long as you're more than that once every 8 hours, at least 3 or 4 times in 24 hours, you're generally in a safe place. Mm-hmm. Other things parents may notice too is that the mucosa in the mouth doesn't look as moist as normal. That can be a sign. But those are other things we kind of look for. Maybe some increased sleepiness. If we really are kind of getting down to the point where the child's pretty sick, then they're not waking up like normal. That'd be much more worrisome. But generally speaking, we talk about counting diapers.
Mm-hmm. Perfect. I see lots of great comments coming in. Thanks everyone for saying hi. I see so many of when your baby's due. We are just so excited for you and glad that you found our videos. So keep the comments coming, keep the questions coming. We will do a live Q&A here at the end. The next question is it okay to venture out with my newborn right away? Or should I wait until they maybe have more immunizations to go in public places or family functions?
Right. So I tend to be pretty cautious about this. And I would bet, I mean, every pediatrician might give you a little different answer on that, but I tend to be pretty cautious for a couple of reasons. One, the newborn just doesn't have the reserve, right? They don't have the reserve that an older child would have. They don't have quite the built up immune system that an older child would have. They're going to get some protection, especially from mom's antibodies. Some of those things cross the bloodstream, so that it's not like they don't have an immune system at all. They do have one. It's just that their protection and defense isn't quite as good, and so I tend to be on the cautious side. Now, does that mean people shouldn't come over at all? No. Like, certainly visitors to the house are fine. Certainly sick people, if you're obviously sick in the newborn period, that's when you might be like, if you could just wait until you're feeling better, then please can come over after that. Trying to keep the distance from that, from people who are actively sick is reasonable. Okay. Keeping numbers down, I think, is good for the baby, but I think it's also good for mom and dad too, who are sometimes recovering from delivery, and you're tired, and you just you're kind of getting used to having baby at home. So having a lot of people around all at once can be a little bit overwhelming too. And so I think it's reasonable to kind of not necessarily be quarantined, but take it easy those first few weeks. Now, venturing out after that, those first set of vaccines, I feel as a pediatrician, I just feel better about that. That like you've gotten your first set of vaccines or some protection there. I will say in the medical field, we kind of think about babies in such terms like, okay, have they gotten their first vaccines? Have they not gotten their first vaccines? And how we evaluate babies tends, we look at them differently on how much lab work we would do and things like that. And so I think you can be a little bit more liberal with like being out and about once those vaccines are given. But that being said, with being cognizant of still trying to avoid actively sick people.
Yes. Mm-hmm. That kind of goes with another question we had on our list with sick people. What about when they're in the same household? So if I have other kids who are sick, or, maybe my partner is sick, mm-hmm. Should we try to keep the baby away from them as much as possible?
Yeah. And that's a tough situation, and it happens, right? Especially you got school age kids. You've got,
daycare.
People go to work, you got daycare, you've got all other things. So, it's not like we can keep out all infections at all times, especially in a big, busy home.
Yeah.
I've seen parents handle this different ways. I've seen dad get sick, and I've seen mom say, you're going in the basement and you're not coming out until you feel better. And that's just the end of the story. I've seen moms handle it that way.
Yeah.
I've seen other cases where it's like, well, this is what it is, Generally speaking, okay, if a child is sick, especially they're that school age, mm-hmm. right, where especially if they can understand what's going on, I think you're a little bit easier there, because then you can say, you know what, honey, you're sick right now. Certainly keeping a little bit of distance, 3 to 6 feet, if you can do it, helps. Right, because we just know how the viruses spread, especially some of these respiratory viruses. They're spread by droplets, right? And these things can spread 3 to 6 feet. So you get a little bit of protection that way. You can say, well, you know what? Until you're feeling better, maybe you can't hold the baby. You don't want to obviously be kissing the baby. Close contact, like it's going to increase your risk of transmission, right? It's as well.
Yeah.
If you can do that, great. Is it perfect? Probably not, right? It's just you're not going to be in separate environments. There's going to be some intermingling that happens. You're in the same house, and we wouldn't ask people to say, you're moving out until you feel better. You can go over to grandma and grandpa's house for a week. I mean, that's hard to do. Right. And so do your best. Hand washing as best you can. Sometimes kids, especially now, they're much more comfortable about wearing masks. Kids, now it's not a big deal, right? Kids are used to wearing them, but people have been around. So if they're actively sick, coughing and sneezing and all that kind of stuff, say, well, until you feel better, honey, let's just keep that mask on while you're around. And usually kids tolerate that real well. So that's another option that people can do.
Awesome. What is the immunization schedule like for babies within the first year?
So vaccines are pretty front loaded. We try to give them as early as we can in life, just to build up that immune system, get those babies protected. And so we're pretty heavy that first year of life as far as vaccines go. there are 2 vaccines offered in the newborn period. That's the hepatitis B vaccine and the RSV vaccine. So those are offered right immediately after birth. Now, the RSV vaccine we usually give in clinic, and that's just during RSV season, which I think has officially ended as of April 1st. So we won't be offering that again until the fall. But those are the 2 newborn vaccines. And then really the schedule where we're doing, groups of vaccines starts at about 2 months of age. That's when at least 6 weeks, but 2 months of age. And then it'll be 2, 4, 6 months are the scheduled vaccines. And then again at a year. We do a 9-month check where it can be sometimes for catch-up vaccines, but usually that's just for a checkup. So that's the schedule. And then there's individual vaccines in there as well.
Perfect. What should I keep in my toolkit at home to prepare for when my baby gets sick? I know we talked a little bit about thermometers. Anything else?
Yeah, a good rectal thermometer, some saline drops to help kind of clean the nose out. Those are great. And newborns just kind of get stuffy as a general rule. Their little airways are small, and so they will kind of get a little just congested. And so having a little nasal saline, just where you can put a drop or two in the nose and clean that out. With which the other item would be the bulb syringe, right? So you can have the little bulb. Some people use what's called a nose Frida now, which is kind of a whole apparatus that you can use to kind of suck the nose out. But having something like that to help you clean the nose out it is good. And then the regular stuff you would have in a diaper bag, diaper creams and such things like that are always good to have. Into your phone, now you can just kind of program in, the Boys Town Hospital phone number. So you've got that. And that way, if there's any question, we do offer a 24-hour nurse line as well, where just if you're not sure what's going on, that's probably the best thing, especially early on when you're like, I'm not really comfortable with this. You give us a call, and then there's a nurse that's always available to help you kind of just walk through things. So having that, our same day pediatrics number, so you have your kind of contacts there. Those are probably the basic things that I would recommend you have.
Yes, and I am linking now the Same Day Pediatrics landing page for all of you to check out. If you want to go ahead and take a minute and add that phone number into your contacts, it's 531-355-7425. And Boys Town Same Day Pediatrics is available 7 days a week. So just as Dr. McCarthy said, if you're ever not sure when baby's feeling sick, give us a call and we are happy to help out and get you seen.
Mm-hmm.
All right. Well, I just have a few more questions on my list, and then we will go ahead and jump into the Q&A. So if you're watching live and have a question on what to do when baby gets sick, leave it in the comments now so we can get it answered. And if you're watching this later on, maybe after this live concludes, after work in the coming days, and you have an outstanding question, message our inbox directly, and I'm happy to share with Dr. McCarthy. Okay, so what are some other things that my family can do to make sure we are healthy and avoid introducing germs to baby?
So yeah, making sure that you're vaccinated. I think once again, I mentioned it earlier today, the flu vaccine, I do encourage it. I've just seen so many people get really sick from the flu, and sicker than I think sometimes they realize. And so I do encourage that. Make sure your vaccines are up to date. The good hand washing, just general hygiene is that's the best way to prevent illnesses. Make sure either hand sanitizer or soap and water regularly before you eat, after you use the restroom. Those kind of things can all help prevent infection. There have been some studies out there. You're just making sure you have good nutrition, you're resting, you're staying hydrated. The vitamin C actually. It can be helpful as far as decreasing severity of illness if you get an upper respiratory infection. So a little dose of vitamin C in the wintertime, probably not harmful at all, and may have a little bit of benefit, certainly. So those are some of the, just the good regular old stuff that you would do to try to stay healthy.
Mm-hmm. What about when it comes to kissing baby, especially when we've got visitors coming over?
So obviously, if you're sick, you're going to kind of discourage that. But a little peck on the forehead, on the cheek, something like that. That's fine. I think as long as you're limiting, number of people that the baby are around per day, that should be fine. Asking people to wash their hands or use hand sanitizers before they hold the baby, I think that's perfectly reasonable. But yeah, there's nothing wrong with that.
All right, great. At what age can you give a baby medicine?
So I think the medicine we're kind of probably referring to here now. So medicines can be used at any age, right? But if we're talking about like medicines for like fever, like a Tylenol or ibuprofen, something like that, we don't really want you treating like a potential fever in that first 2-month period without contacting a doctor and having an evaluation and those kind of things. So we just don't want to mask any fevers, because sometimes fevers can be can mean that there's a severe illness going on in that newborn period. So we would want to know about that. So we really don't want you using Tylenol during those first 2 months of life until those first set of vaccines have been given. Mm-hmm. After 2 months of age, after those first set of vaccinations, then Tylenol can be used as needed for fever, especially after the vaccines. I'll recommend that if they want to use a dose or two of that, that's fine. Ibuprofen, it's not really approved under the age of 6 months. So after 6 months of age, ibuprofen can be used. Cough, cold medicines, we don't really encourage under the age of really 12. We don't really encourage those. In the newborn period, the only thing that really sometimes parents will use, now whether it really helps or not, I've heard mixed reviews on, is maybe little gas drops during those first couple weeks or months of life, or some people use gripe water is another one. So some people have seen, that kind of helps a little bit, pass a little gas or help a little fussiness. Some people use that, and then you just want to make sure you're following the instructions on the box as those are written. So, but that's the general rules.
What about Vicks?
Yeah, so Vicks. Regular Vicks, I wouldn't use until a child was older and they're not going to get it into their mouth. So some kids, because Vicks itself can have some toxicity if it's consumed. And so I wouldn't probably do that until they're closer to school age for regular Vicks. Now they do market what's called an infant Vicks, which I think some people use. It's supposed to be safer in younger kids, and that'd be something I just want to make sure you're not getting it someplace where they can put their hand, get it on their hand, put their hand in their mouth. So, I guess on their chest or on their back, on their feet, sometimes people put it. I imagine that should be okay with that infant Vicks, but yeah, that'd be the other thing.
Awesome. Okay, well, thank you, Dr. McCarthy. We are going to jump into the Q&A. Thanks, everyone, for leaving questions. We'll go through these questions, and then we will draw for the winner after that. How do you know the difference between thrush and milk tongue?
So thrush is going to usually extend around the mouth, so it's not just going to be on the tongue. You'll see it usually on the inside of the lips. You'll see it on the inside of the cheeks rather than just on the tongue. The other thing is thrush doesn't wipe off. So if sometimes you can take a towel and just try to wipe and see if it'll come off. A lot of times, that milky stuff, I'll take a little tongue depressor and just kind of scrape at it, and you'll see that, that's milk. It comes off when I do that. So those are probably the two biggest differences, but sometimes it can be hard to tell. And, we need to look at it to really know for sure.
Mm-hmm. Do babies get allergies? I guess is one question. And then they want to know from pollen or dust or even animals.
Yeah. We don't see a ton of allergies under that 6 months of age, because I think the allergies do take time to kind of build up. I have prescribed medicines for kids with allergies over that 6 months, just to trial. It's hard to tell exactly, but in families where allergies are a big problem, where they know, they're like, I've got allergies, dad's got them, we've got asthma and eczema and those kind of things. Allergies can start under that year of age. They can start. And as far as allergy medicines, which the common ones you might think of as far as Zyrtec or Claritin, really not even Claritin, really just Zyrtec, is only approved down to 6 months. So we don't really use much. We may try a little bit of Benadryl maybe under that 6 month mark, but there's not a ton you can do for babies under the age of 6 months, aside from just trying to avoid potential triggers.
Mm-hmm. Yeah. All right, we're going to do one more question from the Q&A, and then we will go ahead and draw for the giveaway winner. When is the line drawn between spit up and actual vomiting that needs a doctor's attention?
If only there was a line that I could quantify and be like, yes, yeah, that's it. This is clearly vomiting and not spit up. So every baby spits up some. There's just physiologically how they are developing. The esophageal sphincter, which is the lower part of the esophagus that keeps kind of food and liquid into the stomach, just isn't tight enough yet. So stuff comes up. That's just every newborn has some level of vomiting, right? Or quote unquote vomiting. Food comes up. It becomes worrisome if what we call projectile, which is another thing that, well, how do you know if it's projectile or not projectile? If kind of spraying across the room, they're throwing up so much that they're like still hungry after they eat. Lots and lots of fussiness. Like, okay, every baby has a little bit of fussiness, but like we can't calm them down. They're just crying all the time. Those would obviously be worrisome signs where this vomiting may not be normal. Same thing would go as if there's ever any blood in it, or if it looks like forest green, any green color. That's not normal vomiting. The vomiting should be milky, it should be clear. It should kind of come out not really very forcefully. Sometimes it'll seem a little bit forceful, but It shouldn't be regularly forceful like that. So those are some pointers to help you figure out, is this normal vomiting or not normal vomiting? And then if you were to come into the office for it, we'd look at it and say, okay, is this baby getting adequate nutrition? Are they growing appropriately, gaining weight appropriately? How does their exam look? Are there any other things that we're seeing or noticing that don't look right? And that helps us kind of figure that out. And so, you can't really quantify the spit up. It's like parents come in and they're like, he's spitting everything up. And you're like, the baby's like at the 99th percentile. And you're like, well, he's absorbing something, because he wouldn't be that chunky or she wouldn't be that chunky if she wasn't absorbing something.
Yeah.
So it can be hard to quantify.
Sure. All right, perfect. Well, we are just about to draw for the giveaway winner. If you enjoyed this talk with Dr. McCarthy, and as you're watching are actively searching for a pediatrician, I have linked above this video our meet and greet form. So you can request a meet and greet with Dr. McCarthy or any of our other wonderful pediatricians above this video. And we would love to have you and have your family join Boys Town Pediatrics. Okay, so we spin the wheel here, and our giveaway winner for today is, Janelle. Congrats, Janelle. We will send you a message after this video to claim your prize. And tomorrow we are going to be live with Dr. Gillespie on how to manage parenting both a newborn and a toddler. So if you are welcoming baby number 2 into your family and are a little worried about that, we've got plenty of advice to help you out with it. So Dr. McCarthy, thank you so much for your time today.
Great. Thank you. Always a pleasure.
Awesome. Have a great rest of your day, everyone, and we'll see you tomorrow at noon. Bye-bye.